So here we have test question. Pause the video, take a few minutes, read this test, guess which answer is correct, and after, let's discuss this test step by step. So it's 72-year-old woman. She was admitted with acute myocardial infarction, and in order to remove thrombus, PCI was performed. Now she intakes aspirin, and we know that aspirin is COX enzyme inhibitor, which provides anti-aggregant effect. Also, she intakes clopidogrel, which is P2Y12 blocker, and clopidogrel has also anti-aggregant effect. In addition to this, unfractionated heparin was prescribed, and heparin is anticoagulant. We have to know that we monitor heparin effect based on prolongation of PTT, which is partial thromboplastin time. And the most important side effect of heparin is heparin-induced thrombocytopenia. In this case, platelet count before treatment was 210, and after 5 days of treatment, platelet count became 90, so thrombocytopenia developed. Also, she has increased concentration of D-dimer, and elevation of D-dimer tell us about thrombotic events. Basically, D-dimer is a byproduct of fibrinogen consumption, and we consume fibrinogen if thrombi are formed. Among all features that are given to us, only heparin could cause thrombocytopenia. We call this side effect heparin-induced thrombocytopenia, and we have to know that we have two subtypes of heparin-induced thrombocytopenia. First of all, both subtypes are provoked by unfractionated heparin. Type 1 is a relatively safe condition, where just mild thrombocytopenia develops. Type 2 is a severe condition, which is provoked by heparin-induced autoimmune reaction. So, for a better understanding, let's illustrate this autoimmune interplay. There is platelet and there is fibrinogen, and when we infuse heparin, heparin can bind to PF4, this formation of heparin-PF4 immune complexes. The problem is that these heparin complexes can massively activate platelets, and in activated state, platelets bind to fibrinogen with formation of a thrombus, and as a byproduct of this reaction, D-dimer is formed. So it explains why she has elevated D-dimer. Heparin-induced thrombocytopenia type 2 occurs 5 to 10 days after heparin injection, which suits our case, where a patient had 210 platelets, and after day 5 she has 90 platelets, and we can assume that on day 6 it will be 70 platelets or even less. So, because it's a moderate thrombocytopenia, we can suppose that it's heparin-induced thrombocytopenia type 2. But the most important feature is that this condition can be complicated by thrombosis, again due to the heparin-induced autoimmune reaction. The major diagnostic feature in this case is serotonin release assay, and the treatment is immediate discontinuation of heparin and prescription of direct thrombin inhibitors. So, because heparin-induced thrombocytopenia type 2 leads to thrombotic events, as deep vein thrombosis or pulmonary embolism, in this case, as a treatment, we will discontinue heparin and prescribe direct thrombin inhibitor.